If you've been looking into getting a medical marijuana card in Pennsylvania, you've probably seen the official list of qualifying conditions. Welcome to the audio guide from Pennsylvania Marijuana Cards. What does the law actually mean for you, and how hard is the process?
It's a lot more approachable than people think. Pennsylvania's Medical Marijuana Act covers 24 distinct conditions. And what surprises many patients who visit us at PennsylvaniaMarijuanaCards.com is how much that list has evolved to focus on real-world symptom relief.
Right. 24 is a big number. Let's break down some of the major ones because the legal phrasing can be a bit dense. For instance, severe chronic pain is the most common reason people apply, but the state divides it into two pathways, correct?
Exactly. Pathway A is severe chronic pain of neuropathic origin, meaning nerve pain. For that, you qualify right away. Pathway B covers broader chronic pain, like fibromyalgia or severe back pain. But the law states it applies if conventional treatments haven't worked or aren't an option for you.
So if someone has tried standard therapies for their back pain and didn't get relief, that's their exact pathway. What about anxiety? I know anxiety disorder is a huge one in PA.
It is, and the research shows medical cannabis can be incredibly effective for anxiety. But there's a clinical catch here. It's highly dose-dependent. Low doses and CBD-dominant formulations generally calm anxiety, while high THC products can actually trigger panic. It's an area where consulting with your dispensary pharmacist on product selection is critical.
That makes total sense. Start low and go slow. Now, looking at the list, cancer is obviously on there, but the text specifically mentions remission therapy. Why is that distinction important?
It's a massive benefit for patients. It means even if you've completed active cancer treatment, you still qualify if you are managing long-term side effects, like chemotherapy-induced neuropathy, chronic fatigue, or anxiety about recurrence. The state recognizes that recovery doesn't just end when treatment stops.
Wow, that is incredibly compassionate. Now, there is a very specific critical warning in the guide regarding terminal illness and hospice care. Can we touch on that?
Yes, this is frequently misunderstood. Because cannabis is still federally a Schedule I substance, if you are enrolled in a Medicare-funded hospice program, that organization legally cannot certify you or administer it. Terminally ill patients must obtain their PA card independently through a registered physician, and a designated family caregiver can handle dispensary visits for them.
That is an essential piece of advice for families. Let's talk about the final step on the list, Hepatitis C. The guide mentions a unique complexity with liver health.
Correct. While cannabis is historically great for managing the nausea and appetite suppression tied to modern liver treatments, research suggests heavy use could impact liver fibrosis. It's a nuanced topic you'll want to discuss openly during your evaluation.
This makes total sense. So let's say a listener sees their condition on this list. What do the actual steps look like on your platform to get the card? Is it a lot of red tape?
Not at all. At Pennsylvania Marijuana Cards, we've broken it down into a simple 3-step process that completely cuts out the clinic commute. Step 1 is just completing a quick online intake form right here on our page. It takes under 3 minutes, no paperwork to mail, and you get to pick the exact time you want to call.
Perfect. And step 2 is the actual medical evaluation. Who are they actually speaking to on the phone or video call?
You'll be speaking directly with a fully licensed physician registered with the Pennsylvania Department of Health. We believe in absolute transparency, so our primary evaluating doctors, like Dr. Jonathan Chance-Miller and Dr. Anchita Plial, who has over 20 years of experience in internal and palliative medicine, have their official NPI numbers listed right on our website. Anyone can verify them instantly on the federal government CMS.gov website.
Wow, that's great peace of mind, knowing you are talking to a real, vetted local expert. But what happens if someone has a consultation and the doctor determines they don't actually meet the state criteria? Do they lose their money?
Absolutely not. The evaluation takes about 10 to 15 minutes, and our physicians will give you an honest clinical assessment. If they find that medical cannabis isn't the right fit for your situation, you are not charged. Your $159 fee is fully refunded back to you. No questions asked.
Oh, beautiful. So it's completely risk-free to see if you qualify. What's step 3 once a patient is approved?
Once approved, the doctor submits your official certification directly to the state registry the exact same day. Then you just complete your state profile, pay the standard $50 DOH fee, and your physical ID card arrives in your mailbox. It typically takes 7 to 14 days to arrive in the mail, but a digital record is active quickly. Just remember, you must wait for that physical card before hitting the dispensary.
So, from typing your name into the form to getting approved by a verified state doctor, the whole process is smooth, transparent, and completely protected.
Exactly. If you're ready to get your quality of life back, don't guess about your condition. Head to PennsylvaniaMarijuanaCards.com. Fill out the 3-minute intake form at the top of our page and let our medical team handle the rest.
Book your telehealth visit today at PennsylvaniaMarijuanaCards.com. Thanks for listening.